Well, hello, friends, and we're here for another exciting episode of Kidney Talks with the George Washington University Ron and Joy Paul Kidney Center. I'm your host, Reverend Kendrick Curry of the Pennsylvania Avenue Baptist Church here in Washington, D.C., and I have my wonderful co host, Dr. Clive Callender of MOTEP, which is the Minority Organ Tissue Transplant Education Program. And unfortunately, not with us today is Dr. Keith Melanson, who is a transplant surgeon with the Ron and Joy Paul Kidney Center at the George Washington University. So we're just so excited to have with us today a wonderful, wonderful talk that we'll talk about as you see kidney disease and what have you. And we are looking forward to the introduction of our guest.
Yes. Hi there.
Hi, Leah. I'm glad you're with us. We have Leah Vandermark, who is with George Washington University, and she's a clinical social worker there. And she's going to give us a wonderful talk that deals with our kidneys today. So we're excited. Leah, take it away.
Okay. Thank you. Yeah, I'm excited to be here. So I'm Leah. I am a social worker. I work at GW Transplant, and I have worked in kidney transplant specifically for about 8 years now. So this is a topic that I feel, very comfortable talking about, and I think is really important to talk about. So I'm glad to be here today, and let's get started. So we're talking about kidney failure and depression and learning about those two things. So just kind of a review of what I'll go over, answering some questions, what is depression? What does depression look like? How common is it? What's the prevalence of depression in kidney failure patients? Signs and symptoms of what to look for if you think you're depressed. And is it depression or is it kidney failure? And how do I get help, which is the most important thing. So we'll spend time on that at the end. Okay, so just some definitions to kind of decipher what's going on. There's different types of depression, right? So there's a depressed mood, which these are going to go from less extreme to more extreme. So starting with a depressed mood, it's a state where you're really having feelings of low self-worth or guilt or just a reduced ability to enjoy your life. So some feeling down, this state of low feelings. And then depression is really, when we say depression, we're talking about a mood disorder that is persistent depression. So persistent low moods, persistent feelings of sadness and loss of interest. And we really consider that it is depression when you see that the depressed mood has been going on for a long time or is severe. So that's sort of the differences there, which I think can be helpful when you're trying to figure out what's going on. And then major depressive disorder is going to be a diagnosis that either comes from a primary care doc, a psychologist, psychiatrist, a social worker, a clinical social worker can diagnose that as well. And so this is really the kind of criteria in our diagnostic manual, where you have 5 or more symptoms during a 2-week period. And it's usually a change from previous function. So you're doing okay, and then now all of a sudden you have at least 5 of these symptoms over a 2-week period. So, depressed mood, I like to say, some people call it, I'm just in a funk. I don't know how to explain it, but I'm just in a funk. I'm feeling down. Loss of interest or pleasure, just not enjoying the things that you usually like to do, the things that usually bring you joy. Weight loss or weight gain, so just appetite changes if you're noticing that, and trouble sleeping. Sleeping too much can be a sign of depression, so not wanting to get out of bed, and sleeping too little can also be a sign of depression. Fatigue, so just not having the energy. Irritation, we'll talk a little bit more about that. That can surprise people. That can be a symptom of depression. Feeling worthless, again, that guilt we talked about a little bit ago. Decreased concentration if you're not able to focus, and then thoughts of death, suicide, hurting yourself, self-harming thoughts that might kind of creep in. So 5 or more of these symptoms is what would actually get you a diagnosis of major depressive disorder. And then some just general facts about depression. This is in the general population, right? So 5% of adults suffer from major depressive disorder. So again, meeting that criteria for the diagnosis of major depressive disorder. About 5.7% of adults who are over 60 suffer from major depressive disorder. And then, unfortunately, over 700,000 people die to suicide every year. And depression is twice as prevalent in women compared to men. Depression can present differently from person to person. So that's another thing that just to keep in mind. Some people really present as down, they isolate themselves, they stay in bed, they stay home, and other people are maybe doing the same things they usually do, but maybe they're on edge, they're irritable, they're a little bit more snippy. Some people are not able to concentrate, and that is another one that you don't really think about being depression. If you're spacing out and kind of just blanking out, at work or at home or in your community, if you're just kind of feeling like, oh, I just missed what that person said, I was kind of spacing out, that can be another sign that maybe there's some fogginess and some depression going on. So I tell all of our patients, I like to kind of make this a key point that I feel personally as a mental health professional, your mental health is just as important as your physical health. It really is. Those two go so closely together that mentality and having that fight and having that drive and the motivation to get through your medical condition is so, so important. So we want to look at your mental health as part of this whole picture of looking at you as a person. So then looking at kidney disease and kidney failure and depression, right? So there's a lot of studies that have looked at depression and kidney failure and how often is it that we find people who are suffering from depression who are also having kidney failure. So it's about 20% of patients with the early stage CKD suffer from depression. 1 in 5 patients with chronic kidney disease meet that criteria for major depressive disorder, and up to 1/3 of dialysis patients have depressive symptoms. So this is occurring more in patients with kidney failure than the general population. That's what these statistics are telling us. And then something I found interesting that I did not know is depression for people on dialysis has been associated with higher rates of hospitalization. So we're also seeing that people are hospitalized more frequently. So all that to say, you're not alone if you're feeling that way. Like we just saw that statistic, 20% of people with CKD feel depressed and have these depressive symptoms. So you are certainly not alone. That's another takeaway from this talk. So what causes depression? Let's start there. There are multiple things. So we like to look at your life circumstances, what's going on in your life, because life events that are difficult can really increase your vulnerability to be depressed and become depressed. So chronic illnesses that you have, learning of a new medical diagnosis, those are certainly things that are going to make you more vulnerable for depression. And then there is a medical component and a psychological, the biochemical component, that reduced quantities of neurotransmitters in your brain can actually make you more susceptible for depression. So sort of looking at like nurture versus nature and things, and both are very much a part of this. And that's why we always ask too, do you have any family history of depression? It is hereditary. So looking at both of those things. And then just a study, there's a lot of studies, actually newer studies, that show that depression may be linked to um, a lack of physical activity. So people who exercise more are less likely to show symptoms of depression. So just something to keep in mind. So I also like to acknowledge that depressive symptoms really can overlap with symptoms of kidney failure. So fatigue, the three main ones: fatigue, loss of appetite, trouble sleeping. Like those are things that folks with disease and kidney failure start to feel. And so you might kind of come to this question: is my mood because of the kidney failure, or am I depressed? Like, what's going on, right? So this is a tool that I really like. It's a good starting tool to kind of figure out, is depression happening? Um, is depression present? And how often are you feeling these things? So you guys probably have noticed that to get that diagnosis of major depressive disorder, it's about how long you're having the symptoms. It's not just one day where you had a bad day, you were feeling down, or you were not feeling well. And then the next day you were okay. It's a persistent course. So it's called the Patient Health Questionnaire. Many of you have maybe, hopefully, seen it. It is widely used in the US throughout medical facilities. So maybe a doctor's office had you fill it out before you came in. And also, we actually give this to all of our transplant patients when they come in. So I hope you've seen it before. And this is just a starting point. And I have highlighted, again, those three symptoms that really overlap. So if we're seeing a patient that maybe just has those three symptoms, sometimes we try to decipher, is it the kidney failure, or do you also feel depressed? So we might ask additional questions there. And on the right side of the screen is the scoring tool. So if you score 0 to 4, it's estimated there's no depression or it's very minimal. 5 to 9 is going to get you a mild rating, and 10 to 14 moderate depression, 15 to 19 moderately severe, and 20 to 27 is really severe. So just looking at that. So some takeaways again that I really want to kind of drive home. So even if your symptoms are being caused by your kidney failure, you could also have depression, and that's okay. So, you may have people in your life who may say to you, "Oh, I think it's just your kidneys that are failing. That's why you're so tired. That's why you're staying in bed all the time. I think it's just your kidney failure." But it might be more than that. So just consider that. And if you are having, on the other hand, if you are having symptoms of depression, and it's those symptoms that are the same as kidney failure, it might not mean you're actually depressed, but you really want to look at how you feel and if the symptoms are persistent. So they're over time. So what should I do if I continue to feel depressed? This is the important part. So this is the hard part. This is what we ask a lot of you. First and foremost, we would like you to ask for help. You're not alone, again. So my advice for people is just remind yourself, you know your body best. You are the expert of your body and your mind. So you can advocate for yourself knowing that you're really the expert. So tell a medical provider that you trust. It doesn't have to be your nephrologist. It doesn't have to be someone at the transplant center or dialysis. But if you have any doctor that you trust, go to them. Maybe your dialysis nurse or your dialysis tech. You get really close to these folks. So tell someone you trust. And just a line that you could use is, "I've been feeling down and I think it's more than kidney disease." So you could say that to someone. And of course, confiding in people in your life is very important, or contact a mental health professional. And I think that mental health professional piece can be good because that's someone that you don't feel like you're necessarily being a burden on, versus someone who you're close to. So, if asking for that help seems really hard, which it is hard. Other things you can do: educate yourself about kidney failure. Knowledge is power. Being here, watching this talk is so important. Just educating yourself is great. It's a great way to feel like, okay, I can do this. I know more about it. Move your body, go on a walk. Again, it is physical activity is linked to depression. If movement is hard for you, sit outside, sit in the sun, take advantage of the weather when you can. When you're, if you're waiting for your ride after dialysis, take a step outside, stand in the sun. So just kind of getting that fresh air, relying on your faith, of course, and just using that community, volunteering, being active in your community, prioritizing good sleep, creating better daily routines, just getting into some good routines where there's some consistency in your life. And then the last one is really great: reframing your thinking. This is something you will learn if you do go to therapy. So just an example of this is, I hear all the time folks are not able to work. They've gone from a lifestyle where they're working to not working. And I try to encourage them, okay, let's change that. Let's change that thinking. You are working. You are working really hard, and going to the doctor is your job. So showing up for dialysis, that is your job. Going to the doctor's appointments, that's your job. So you are working hard. Just kind of reframing your thoughts. That's a big part of therapy. So speaking of therapy, I just put on this slide a lot of great resources. Psychology Today is my go-to for finding a therapist. There's also support groups on there. SAMHSA it actually stands for substance abuse and mental health. So both, they have a lot of good resources. Kidney specific, there's this renal support network. They have support groups listed on their website. And then there's TRIO, which is peer-to-peer support groups are listed on their website. And then DC specific for our folks in DC. So the DC Access Helpline, I give this phone number out. There's someone on call 24/7. They will connect you to a mental health provider. So it's 1-888-7-WE-HELP. And emergency psychiatric services. If you're in crisis, there's a 24/7 line, a phone line to emergency psychiatric services for adults. So really just taking advantage of the resources is super important. And that's it. I'm wrapped up. Here's my contact information. I am available to answer any questions and concerns. You can email me if you want more resources or any advice. I'm happy to help. I really enjoy, talking to patients about this topic, and it's so important, and it's not talked about enough. So if I'm the only person that anyone feels comfortable contacting, calling, emailing, I'd be glad to be that source of support.
Well, thank you for an outstanding presentation, Leah. This has been very, very rich. I do want to encourage all of you that are watching either Facebook, YouTube, or whatever social media platform you're watching on, or even using your computers at blackdoctors.org. I would encourage you to really tell your family, tell your friends about this presentation, and because it's been so important. And I hope that you review it and re-review it over and over again. So Leah, thank you so much. And those that are online, please share with everyone what was shared here. And I would just say to you, put some questions in the chat. I know we have a great many questions that we could ask Leah, and she's available right now if you're on live. Dr. Calendar, you want to start with your questions? Because I know I have several.
The first question is we've been involved in a pandemic for the last 2 years. As How has that impacted you and your practice since COVID has caused so many people to be in isolation? Uh, how has that impacted you and your practice in terms of the renal patients and the depression rate now that they've gone through the pandemic?
Mm-hmm. Absolutely. Great question. Yeah, so I do believe that the rates of depression have gone up in the general population. That is for sure. And we'll get probably more data on that as time goes on. Um, but yeah, I what I have noticed is for mental health, a lot of the resources shifted to online like everyone else has been doing. And so that is really great. There's actually been state specific kind of emergency services where even providers across state lines can provide help. So that just makes it more accessible for folks to find a psychiatrist, find a therapist that they can meet in the comfort of their own home or wherever they feel comfortable to talk to someone. Also, helplines, all of the phone, help is only a phone call away. And so I do think it's made it more accessible. We've had to really think hard about how do we get this help to people in need who are at home. So that's a great question. And I know dialysis centers, of course, if patients are going to dialysis, they're still going in person. And so the social workers there, I have really connected with because that might be the only time the patient is leaving their house and people are getting out. So it's really important that we're asking folks, hey, how are you doing at home? What are you doing at home? How are you spending your time? So good to check in with people when you do see them in person because a lot of the time we're isolating and by ourselves.
Wow.
Another question I had is, what is your impression of the value of this new 988 number for people who have concerns about suicide? Do you think that's going to be helpful or not? What's your assessment of it?
Yeah, that's a good question. Yeah, I think accessibility is so important. And I think when it comes to suicide, that is something that, depression is certainly not talked about enough, but suicide is absolutely not talked about. And that can feel like a really, really sensitive topic. And so I do think it's nice to see that there is, a helpline and that it can, that someone can be reached at any time. And I know like there's texting services as well,
Yes.
even if you don't want to call. Now you can just text, I think, like a certain phrase to a certain number, and that will get you online with someone who can text you right back and say, hey, and as a mental health professional, we're trained to ask those hard questions to say, hey, have you thought about hurting yourself?
Yeah.
Do you have the means to hurt yourself? What's at home? Do you have access to firearms? Do you have access to pills, to things that people can use, and really asking those questions because that is needed. You have to ask the hard questions, and people in crisis appreciate that because no one else is asking them about it. People in crisis need that help, and they actually really can benefit from just having someone on the other line because a lot of it again is from isolation, not talking to others, feeling alone.
Yeah. I wanted to ask you, you gave a great listing, and I wish we could put all of them back up on the screen, but of symptoms. First, you defined depressed mood and then depression. And then you said there were five symptoms that at one given time you would find yourself able to that sort of understand if you were in a depressed mood or not. I
Mhm.
was wondering, is five some magic number? Does it happen over a period of time? Um, how are we really to look at that? I think it's near the beginning of the presentation.
Yes. So that is from the DSM, so the
Yep,
Diagnostic
that's okay.
Manual. And so that's where that comes from, um, where you're seeing that in order to meet the major depressive disorder diagnosis, the physician needs to see 5 or more of the following symptoms during a
Mm,
2-week period. So yeah, that is very specific. And so I like people to know that because you can certainly be depressed without meeting the criteria, right? There's not like a blood work you do or a lab result that tells you, okay, your number is more than 10, you're depressed. There's not that. It's really about how you feel. Um,
sure.
but yeah, I think it's helpful to know what doctors look at if you do get a a major depressive disorder diagnosis. Then you can kind of know, okay, I must have met criteria for 5 or more of these symptoms. And then that might warrant medications or therapy or a combination of both.
Both. Yeah.
So that's also going to indicate how you're treated.
Sure. Would you recommend that anyone just take the PHQ-9? Is it available online for somebody to sort of, I don't want us to self-diagnose, but at least find out sort of where we are?
Yes, I think that is a great tool. It is actually made for patients to obviously it's self-administered. So the when you go into a doctor's office, you're not going to have a doctor read any of these questions to you. You're just going to be handed the form, so you can absolutely fill this out and use it. Again, I think like I have talked to many patients who kind of just chalk it up to their kidney failure that they feel down. And I'm like, okay, well, it could be, and that could be very much so, but let's look at it specifically. And this really looks at it specifically because you're looking at, little interest or pleasure. Is it not at all? Is it several days, more than half of your days, or nearly every day? It's really kind of breaking it down to specifics. And I think if you did take this, you could use this as a tool for your providers, for your doctor, for whoever you're talking to, even your family, to kind of say, hey, I think that I'm meeting criteria for depression. Maybe I should talk to someone about this.
Hmm.
And it really breaks down what's going on, which I like.
Wow. Uh, there, someone in the chat would just like you to drop your email or share your email again so
Sure.
that they can get this information. This is some great stuff. And one of the things I think that you've done and done marvelously well is shown a correlation between mental health and physical health. In fact, you said mental health is just as important as physical health. And then you actually demonstrated a correlation by talking about 20% of those with chronic kidney disease have some form of depression. And I'm very interested in knowing, is that consistent with other disease, HIV, for example,
Mm.
or cancer, or any of the others? Um, Advanced illnesses. Is there a correlation between the mental health and those?
Yeah, great question. I don't know the specific prevalence, but I do know that looking at chronic
Mhm.
medical concerns, the rates of depression are much higher in
Wow.
chronic illnesses. So,
Mm,
which makes sense, right? Because it's something that everyone's dealing with every single day, and it's
mhm.
something that needs ongoing treatment. So
Sure.
rates of depression are higher in with folks who have chronic illnesses that require constant treatment, taking medications every day, going to several doctor's appointments. Yeah.
So So, Dr. Calendar, in your experience with MOTEP and all of the years you practice, you're the guru at all of this with regard to kidney disease. How many of your patients over the years, or would you say patients over the years, have experienced some form of depression while dealing with the various stages of kidney disease or other illnesses?
It's extremely common, and I had the opportunity to work with the great psychologist John Robinson, and,
Okay.
and he was had to be available actually on call 24 hours a day,
Oh
because
wow.
not only did you have trouble with the renal patients, but also with the transplant patients,
I
because
see.
some of the medications that we gave them, the steroids, for example, resulted in them having mental crises, psychological
Mm,
crises, nervous breakdowns. So that it brought up another question, though. It raised the question of what President Biden talks about in his inaugural address, State of the Union address, and that is the access to mental health, uh, mental health help
yeah,
on the part of everybody. Is there really a reasonable amount of access? Because I know there are certain psychiatrists who won't see you and psychologists who won't see you unless you pay cash. They won't accept insurance.
that's
So
right.
is this a real problem, access to mental health or not? What's your take on it, Leah?
Yeah, I agree. There really is. I think we've done a little bit better. I do think COVID has helped the accessibility, but it's certainly really frustrating when I have patients who come to me and say that they've been trying to find a mental health provider and they can't find one because of insurance issues or because of um, even just the time or the availability of that therapist. You know, they may only see patients at certain times. um, so yeah, that has been an issue that's ongoing, unfortunately. And I think the mental health providers, there's certainly been a lot of burnout as well because the need for mental health services has gone up. So we are seeing, folks kind of leave that field to leave the mental health field.
Wow.
Let me
Wow.
ask you another question. What is the difference between that patient health questionnaire that you demonstrated so beautifully and the screen? Because I read just yesterday that anxiety has increased so much that they're recommending health, mental health screening for all adults under 65. And so, what's your take on that, Leah?
Okay. Yeah. So that screening, the PHQ that we saw is specific to depression. There may be general mental health questions that providers ask as their screen. That's maybe their screening for mental health concerns. There is another really good tool for anxiety. So, we should keep in mind too that anxiety is a hot topic and a very important topic to talk about too, and is also very prevalent in folks who are suffering from medical concerns. But yeah, that is called the Generalized Anxiety Disorder Tool,
Mm,
the GAD, and it's very similar. We give our patients both of those. So just kind of looking specific to depression, specific to anxiety, we want to flag those concerns when we meet with patients. But I would certainly say that I hope providers have sort of a mental health screen that they like to use with patients, maybe a more general um, list of questions that they can go through with them at their appointments.
How about the stigma that's associated with mental illness? Have we overcome that, or is that still a problem for your patients?
It is still a problem. It is definitely still a problem. It's difficult, I see it in everybody. It's not it to me. It doesn't stand out necessarily which patients are not willing to talk about it or too nervous to talk about it or whatever it is. I like to meet with patients alone if I can. I love to see that their family's there, and I use, part of the time I meet with folks, I talk to the family as well. But then there's also an opportunity to say, hey, can I talk to you alone without your family? And sometimes that information will really come out when the patient is one on one with you and they really feel heard, and they don't feel like their family is there judging or having any kinds of concerns. They may not want to be a burden on their family. So they just don't want to tell their family because they feel like that's really being a burden. They might already feel like a burden if they're going through um, medical concerns and having doctor's appointments all the time. So yeah, I do think that that can help to reduce some of, maybe not reduce the stigma, but at least get that information out, is to talk to folks one-on-one. And then, yeah, I think just talking about it more in general, even when you're not depressed, we should be talking about mental health. We should be checking in on each other. We should be, sending just, hey, how are you doing messages, and just checking in on one another, even when you're not feeling depressed. It's actually, you will probably remember to talk to folks and check in on folks when you're feeling good. So use that opportunity when you're feeling good to talk about mental health.
For Dr. Curry, I want to ask a question that may involve you. For example, do Christians get depressed? You mentioned the role of faith. Do Christians commit suicide? Do they get depressed? Or what is your thought on this, Leah and Dr. Curry?
Yeah, glad you raised the question, because I actually was going to raise that question. It's on my list. Indeed, Christians, we found, the studies will show that Christians get depressed. Those that have faith get depressed. Um, we are, and we have had those that are believers. In fact, I've done um, funerals of those believers, Christians, that have committed suicide. And one of the things that I know as a pastor, while I've had pastoral care, and you've done some of your clinical education and all of that other stuff, I do understand that it's important to refer, because faith is one component, your spiritual being is one component, but your mental health and mental wellness is tied to it, and it's a distinct component that we need to contend with. So all believers out there, I would say, whatever your faith tradition is, I'm decidedly Christian, but I also advise you and encourage you to get the mental health treatment that you need to deal with anxiety, to deal with all of the other stressors of the world, particularly around depression. Um, and so, yes, Dr. Calendar, yes, 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 folks struggle. Folks struggle. While we're in these bodies, we will struggle. And so we're going to need all of the help that we can. And just saying pray about it is not good enough. We have to work on raising those questions that 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 one from Nazareth would say, Jesus would say, do you wish to be made whole? And the answer is yes. And we are spiritual, emotional, physical beings that really need to be made whole. So yes, we have to look at it all. I would say, Leah, you raised the question about relying on your faith. And what you've also shared in a very interesting way is a couple of things that is very important to in faith. And one is safe space, right? You create safe space where you could talk to somebody. And two is the positive affirmations that you begin to talk about these wellness check-ins, because we believe that faith comes by hearing, and hearing by the word of God, And so as such, as you repeat it, as you start to speak these things, they start to help you. And I'm wondering, are there affirmations, are there mantras, are there other things that we can sort of center ourselves around that will help us when we start to feel that we're going toward depression,
Great
especially if
question.
we have a chronic illness?
Yeah. Yeah. I think it's so important to find something that resonates with you, because everyone is different. And just to, add to your point, mental health concerns do not discriminate. They are in, we all struggle. We all struggle. There are a lot of causes of depression. Going back to kind of talking about that, we talked about life circumstances. So your life circumstances really can cause you to feel depressed. I think it's good to find something that's gonna lead you, that you really believe in. So, for some folks, maybe telling themselves, "I am good enough. I am good enough. I am deserving, and I am good enough, and I am loved." For folks who feel alone, um, feeling like I am not alone. Naming the people they do have in their
Yes.
lives. So anything that really resonates with folks, there is no wrong way to kind of find that motivation that gets you through and
Yeah.
can lead to positivity. There's no wrong way to do that. It's very personal.
Well, I want to raise a question here that's made from a statement in the chat, and I think it's important as it relates to transplants and mental health. The person raised a question or made a statement, said, if your kidney donor died from suicide, does that increase your chances of suicidal thought? Some I think that's a very interesting question. What would you say, Leah, Dr. Calendar?
I would say that that's an interesting question, and I'd be interested to hear what Leah has to say about it. But the reason why some people commit suicide is related to some of the serotonin and other factors in the brain. And
Hmm.
there's no evidence that that is associated with the kidney itself. So there would not seem to me that there'd be any correlation between whether the donor died of suicide or not and how that would impact the transplant recipient.
Mhm. Yeah, I would agree with that. Um, and in fact, if Dr. Melanson was here, he'd probably tell you that some of the best kidneys that we get, unfortunately, come from folks who died by suicide, because again, they are healthy individuals who may not have a lot of medical concerns, but mentally they're really struggling. And so we get there are kidneys that go to transplant recipients that come from patients who died from suicide. But yes, there's not a medical um, correlation between receiving a kidney in someone from someone who has passed away from suicide and then having thoughts yourself.
Leah, you made a comment about the association of mental health with exercise and sleep.
Yeah.
Are there any uh, levels in which we should search for in terms of the hours of sleep we should have and the amount of exercise we should have on a daily or weekly basis?
Yeah, so the recommendation for sleep is between 6 to 8 hours every night. That is sort of a nationwide recommendation by the medical providers, and the amount of physical activity is trying to get moving for about 30 minutes per day. This can look different for everybody. It's really about your tolerance. So going on a walk for 30 minutes, moving your body for 30 minutes. If that means playing a sport that you enjoy, or dancing, or playing with your grandkids, playing with your kids, all of that. So just any movement for about 30 minutes per day is what they recommend, which I think is and it's also helpful I don't think I put this in any of the slides, but helpful for folks to set goals. That's another way to sort of motivate and reduce depression. So looking at, what kind of goals can you set? Can you set a goal of starting to move, 30 minutes a day, a couple days a week? Start small and build up to that 30 minutes a day every day. But yes, that moving your body has been significantly shown to reduce depressive symptoms, and you see less depression in folks who are active.
Mm-hmm. Well, I am excited about this conversation because I don't think I've ever had one of these types of conversations necessarily associating mental health. We usually isolate it and keep it by itself, along with advanced illnesses. And I think this is really, really important because you tied in faith components, you tied in exercise, you tied in a whole bunch of things that make us whole human beings, all the dimensions of what it means to be human. And I'm wondering, um, how do we share with people, doctors, even policy leaders, pastors, and others, the importance of mental health being just as important as physical health? Because we all work with the heart, the kidney, the liver, all of those, the brain, and all of that. We know we get a regular physical every year. But I don't know of any routine that we have with regard to mental health. When should we check in? What does that look like? You know, what do you think, Leah? Dr.
Yeah,
Callen?
that's a really good point. That is a very good point that we really don't have a standard for checking in about our mental health. And I would say talking about it is where we have to start, because I do hear when it becomes personal, that's when it impacts you. That is what really speaks to you. So, in terms of creating policies, in terms of change in the stigmas around mental health, sharing your story. That's another thing I really like to tell patients is share your story. Your story matters and it's different from anybody else. And that is super important to remember when you're going through this. Again, you have gone through something that is relatable in some ways but not in others, and it makes you special, and it really is all you have is your story. And so using that story, telling folks, hey, I suffer from depression. This is what it looked like for me. This is how I got help. That's really important to share those stories. And I do think that when it does become more personal, when someone says, hey, yeah, actually, my brother went through that. Or, hey, actually, my cousin just told me that he was struggling from depression. That hits us a little close to home, and that hits us a little harder. And you stop and think about it. So that's really important. That's where we should start, I think, to just reducing the stigma for policy leaders to hear us and just know that mental health is just as important as physical health.
Right.
You got to start with your own story and share and talk about it.
Mm.
I have a different take, and this take is that it's not that mental health is an important part of physical health. It's that you're not healthy unless you're whole in body, mind, and spirit.
That's right.
So that it's not separable. So you're not in good health unless your body, mind, and spirit are in good health. And that's the sooner we can look at it from that perspective, I think the better off we are.
Yeah, we definitely want to be in good health as our soul is in health, and I get it, but we don't talk about it enough. I will say, co-located at our church, we've been working with a mental health provider, one of the larger ones in DC, for nearly over 7 years. So I do understand that, and we have folk come all the time, and it's really that we deal with spirit, soul, and body, just like you're talking about, and that I think that's of critical importance. The thing is, when I look at the growth cycle and all of those discussions, very rarely do we ever talk about mental health
That's right.
or even emotional well-being, whatever you want to call
Yeah.
it. We need to do a better job with regard to that, and I'm particularly concerned about that, and would like your vantage point, Leah, um, for those that lived in depressed areas, particularly with uh, the high margin products that they produce in corner grocery stores. So chips and sodas that often lead to all sorts of poor health conditions, and you have great disparity. What would you say to them about
Mhm.
thinking about mental health?
Mhm. Yeah. I would say everyone has a mind. And everyone, again, folks struggle, bottom line. Um, and so it is hard when you have things working against you. It is hard to prioritize mental health. When you
Hmm.
have lack of resources, it is really hard to prioritize mental health because that to you may not seem like I need to do this to survive. But
Yes.
the fact is, you do, because depression is killing folks. So you do have to prioritize your mental health because it will escalate, and it's so much involved. It's so connected with everything that food, from what food you're eating to how much you're exercising to what your lifestyle looks like. So it's all very much related. And it's not to say that any one of those is better than the other. But again, as we're talking about whole body approach, all of it. You need to think about all of it, consider all of it, and just kind of remind yourself that your mental health really is serious, and that this is something that can impact your life and can cause you problems in those other areas too. So they
Sure.
might, folks might be focused on, okay, I don't have time to go to therapy. I really don't have time to go to the doctor to talk about this because I got to go to work because I have to feed my family. And 100%, that is real. And that is something that you need to do. We get that. But if your mental health also starts slipping and starts being, concerning and really takes over, you're not going to be able to go to work. You're not going to do a good job at work. You're going to be distracted. You're going to be zoning out. You're going to be feeling down. It's a snowball effect, I think. It can really
Wow.
snowball.
Wow. I wish we had so much more time to go on, because this is a very rich subject as we deal with kidney failure and really mental health, and all run the full gamut. I just say wholeness. We should talk about wellness and being made whole. And I'm just so glad and so thankful for you, Leah, for coming on with us and sharing the work that you do and with the Transplant Institute, and how you're using your clinical mind and your work to really help some folk understand these connections between chronic kidney disease or kidney failure, mental health, and other conditions. And Dr. Callender always gives us a holistic understanding of how we as human beings need to come together. So and just be made whole. So I'm just grateful for both of you just sharing, and thank you to all of our audience. And Leah left her information in the on the screen with regard to the email to contact. This is critically important, and we need you to make sure that you're paying attention to your health, to include your mental health. Because as Dr. Callender said, you're not well unless all of you, the whole of you, um, uh, you're really well together. If you like what you heard today, just keep hitting that like button over and over and over again, um, so that folk know that they need to pay attention to what's happening with these kidney talks with the Ron and Joy Paul Kidney Center. I'm Kendrick Curry, and I think that's about it. Our time is up. And I just look forward to Leah having you back on again. And of course, Dr. Callender, along with Dr. Melanson, we will look forward to having you again and again and again so that we can make this relevant for the people of this day and age. Thank you so very much. Have the best day in the world. God bless. Bye bye.